Even as experts continue to warn of the impending third wave and also as the cases are dwindling in the state of Karnataka, but the mask violations have only gone up nearly tenfold. For example, if you're taking in the month of June, the city was reporting at least about 5,000 cases. And in the month of July, subsequently, we were looking at a considerable jump of nearly 20,000. And as of today, what we're looking at is every day nearly at least about 1,000 people are being fined, which means as of now, nearly, in fact, 22,000 people have been booked. Now, we are standing at KR Market, which is one of the busiest markets here in the city of Bengaluru. One of the major things, the violations that we are looking at here is especially not maintaining social distancing, at the same time not wearing masks or not wearing in a proper manner that it should have been worn. Now, as far as BBMP is concerned, what they tell us is that they have deployed nearly about 800 marshals across the city, but however, people have let their guard down and they have to be careful about the impending third wave. So if you really notice, initially during the first wave, we had, people had that more fear in themselves and they had to wear the mask. But now, if you go out there, we have enough number of marshals, police officers, health inspectors, fining the people for not actually wearing masks or not maintaining social distancing. So what really is actually being done from the BBMP front to ensure that people will wear?
You see, mask discipline is the most important thing. Any person can escape number of infections, including COVID, if you wear a mask regularly. And obviously, we know that in COVID management, etc., this is the most important measure that a citizen can take. And it is in your hands. You cannot control who comes in front of you. And but if you wear masks and masks continuously, that is always very, very helpful. The surgeons, for example, they are handling COVID cases. Our people, our doctors, our paramedical staff are handling a lot of cases wearing masks, and they are safe. And that is the mask has saved them. So therefore, what is important is people should realize it's not just an administrative diktat, but it is important for their own health, and that will make the city secure, safe and secure. So that kind of knowledge has to be there in the minds of the people. Number of people are there, vaccination, they have had vaccination. Now they say, no, nothing will happen. It still may happen. The severity may be less after vaccination, but still you require masks.
One question is, in the month of June, we had about 5,000 people being fined, and then July subsequently 20,000. Now in the month of August, we're looking at 22,000. So does that give you all an alarm to the health department, to the BBMP, with the impending third wave as suggested by the experts? How much of it can be done by all?
One thing is there, we are seeing a lot of voluntary mask compliance among the people. While our teams are there, we have mobilized a lot of teams at the ward level. We have special teams at the constituency /division levels, and 54 such teams have been organized with 5 members each for enforcing COVID enforcement behavior. We have home guards, we have BBMP marshals, the police officers also. Beside that, BBMP health officials have also been garnered for this purpose, and they can also, in a local jurisdiction, they can take severe measures, including fining and including shutting down of premises or areas, etc., if there is any kind of threat to public health. So all of this is there. So what I would say is that we have had sufficient enforcement machinery. What is required is voluntary compliance. I am seeing a large degree of voluntary compliance, and I am happy. As far as Bangalore is concerned, Bangalore has, in spite of large opening up of the economy and commercial activities, etc., in spite of that, we are seeing the number of cases to be well within control. And we are monitoring this on a day-to-day basis. Where exactly they are happening, we are taking measures regarding containment zones, further restrictions, etc. So all of that is there. We have seen, say for example, since last 30 days, the number of cases from about 400 per day has come down to 300 per day. And still it should go down further. But we have to guard against people bringing it from outside. Okay. So we have to guard against people throwing off their mask and doing partying in the night. We know that there is a night curfew which is prevalent. So what is required is people should realize it's a threat which is still looming in the society.
So are you all contemplating on increasing the fine? Because now it stands at 250. If earlier you remember it was about 1,000 and then people had apprehensions and they were forced to wear, they didn't really have a choice.
I don't think quantum of fine increase is the answer. What is important is that people should realize it is in their own self-interest. You cannot keep on fining and thinking that people will understand. People have to understand because of continuous sending of information or propagating this kind of health requirement through the media, and for that obviously your communication to the people is very important. So I would say that there is a large degree of voluntary mask compliance, but still there will be certain sections which may not do. One. Number two is when you are particularly eating or drinking with anybody, at that point of time, you understand you have to take off the mask, and that is the area where you become susceptible or vulnerable. So that is important, and that's the reason why one has to be careful almost all throughout.
Any action plan for the third wave, which the impending?
The third wave, experts are talking about third wave. Some people say third wave will be like this. Some people say third wave will be like that. Some people say third wave will happen then, etc. So all those are left to the experts. We are not experts on that. We only know one thing, that if you have mask compliance, if you are vaccinated, if you keep away from people, large crowds of people, etc., then in that case you are largely safe. And not only you, but the people around you are safe. Like, for example, the parents of the children, rather than and doing anything to the children, we know that children cannot be administered vaccines right now. But if the parents are safe, the people around the children are safe, and they are vaccinated, in that case it protects the children as well. So that is what is important.
Thank you so much.